So I majored in psychology. I went to Carthage College, getting a bachelor's degree in psychology there. And I liked psychology a lot, but most of my friends were hard science majors, biology majors, chemistry majors, and they ridiculed me for the first 2 years of my academic career for how easy psychology was compared to their fields of study, or at least so they thought. And they actually dared me to take the Introduction to Biology class in my junior year by a woman named Evelyn Crump, who was the chair of the Department of Biology there, and she was widely feared and known at the school as being the toughest teacher probably that anyone had ever had. It was my favorite class ever. She was the best teacher I ever had. Loved emergency medicine, loved internal medicine, couldn't really decide which one I wanted to do. The school was small enough that the chair of each department got together and devised a residency that would allow me to study both internal medicine and emergency medicine. It just seemed like everybody knew each other, everybody liked each other. It was the kind of place where people just kind of worked together. It felt like there was just a camaraderie that I had never really felt in a hospital, not just with the medical staff, but just everybody. It was a very warm feeling. I view a physician or a healthcare provider as you could say a consultant to the patient. The patient is in charge. I work for the patient. My job is to try to figure out what their goals are, what their priorities are, and then help them reach those priorities. And then also I think to point out some things maybe that they haven't thought of as, if they say, well, my priority is I want to lose 20 pounds and I want to get a six-pack. Well, that's great, okay, but let's also talk about maybe making sure that as you get to the appropriate ages that you get screened for the kinds of cancers that we can actually help you with if we catch them early. How about that too? Are you interested in that? Are you interested in preventing yourself from having a heart attack or a stroke? Then we need to keep an eye on your blood pressure. We need to keep an eye on your cholesterol. Things like that. So I guess simply put, I think my role is to help my patients meet their goals regarding how healthy they are, what they see as an ideal life. But I guess to sum it all up, I really like being of service and feeling useful for people.